My name is Dr. Ujala Nayyar, and today I'll explain you the process of active and zero surveillance. For polio program, we are running two types of surveillance for acute flaccid paralysis cases. One is the zero surveillance, in which the hospital sends you the information on their own. And the second is active surveillance, when we go to the hospital and we go to the doctors and talk to them and we scan the registers, and then we find out the acute flaccid paralysis cases. For active surveillance, which is a major part, we have to go to the hospital and check each and every ward and all the outdoors, indoors, emergency. In the wards, we have to go to the neurology, medical, orthopedics, physiotherapy, intensive care unit. And we have to meet the nursing staff over there. We have to meet all the healthcare providers. And then we have to scan all the registers where we see for the acute flaccid paralysis cases, and then we proceed further. Okay, thank you. So when you come to the hospital, you come to the nursing counter, ask the sisters and the staff, greet them, and then go through the registers. I'll go through this register, I'll review all the diagnoses, and I'll look into this, that if there is a case which is falling into the definition of acute flaccid paralysis. Our target is that any child less than 15 years of age having a differential diagnosis falling into acute flaccid paralysis, we check that patient, we review the documents, we do the neurological examination, and then we do the stool sampling if it is necessary. Now it's like rheumatic fever, it's a non-AFP, DBD, non-AFP. Then this case is transverse myelitis, so it can be a potential AFP case, and it is tagged as an AFP. This is a rule out CVA case, and we can see that EPID number is already given to this child. So it means that it is investigated for AFP. Epilepsy, it's written as non-AFP. Meningitis, rule out GBS, it's a definite AFP. This is traumatic neuritis, it's an AFP. So when we are looking for acute flaccid paralysis cases, GBS, Guillain-Barré syndrome, and traumatic neuritis are the two major diagnoses which we cannot neglect, although there are almost 100 diagnoses which fall into this definition. So this register was checked up till here. So it means that all these patients are scanned now. After this, I'll take this file which belongs to a case which can be an AFP, and I'll go and see the patient over there. For active surveillance visit, we have to remember few things, that when you go to the hospital, you have to visit every single unit. You have to go to neurology, orthopedics, surgery, medical ward, ICU, and physiotherapy. After visiting the outdoor, it means where daily patients are coming, you need to go to the emergency department. With that, you have to check the presence of these orientation materials, that they are present in the hospital or not. If not, you bring this material and provide it to the responsible person for proper placing in the hospital. Another important factor is that you need to go to the EPI center, meet the focal point, and check the routine immunization and the availability of cold storage. And plus, you'll go through the zero reports. In the zero reports, you'll go through the previously reported cases in the last week and whether the EPID number is allocated to them or not. This is your stool carrier. When we decide that we need to collect 2 samples of an AFP child, then we give this stool carrier to the family so that we can take the stool samples. First of all, I'll show you the things which are inside the carrier. We unwrap the straps, we pull it from the slit over here and move it on one side. Then we have this foam inside to keep it like cold properly. Then we have 4 ice packs. These ice packs are frozen beforehand, and it needs 24 hours to completely freeze them in freezer. So these are the other one. I'll place them back. And this is the kit we have for stool collection. We have a lab form for it. Patient details are entered into this form along with the stool samples details, and then we send it to the lab. Then we have these kits. This is the most important thing. There are 2 kits, as we have to collect 2 samples 24 hours apart. We apply the sticker on the kit and write the name of the patient. We tell the parents that they have to collect 24 hours apart 2 samples. You'll open this. It has a spoon, and the parents have to collect this stool sample from a clean surface, not from the commode or the flush. They have to tell the child that either shit on a clean surface or from the pampers if the child is a very young baby. And this needs to be filled up to this point, half of it. Or we say we need to collect 2 thumbnails. And then we close it. Similar procedure for the second stool sample, and then we wrap it in the cotton and place it back in this shopper, the second one as well. Close this form, place it into this second shopper, this shopper into this one, bigger one, place it back within the carrier, 4 ice packs, place the foam properly, and then close it. This can keep the stool frozen for 24 hours and in proper temperature. But if we are unable to collect the sample 24 hours apart, or because of any reason we are unable to send it, then we have to change the ice packs again. If remain unopened. If the ice pack is opened or the ice stool carrier is opened again and again, then the samples are destroyed by the thawing and thawing of this material.